Good afternoon or good morning, depending upon where you are in the world. My name is Luc Denil, and I will be moderating this session today. If you have been able to attend some of the previous presentations today, you have already experienced what an exciting event the Oxford Dysfluency Conference is, as it has been for many years now. It's my pleasure to introduce the speakers today. We have three presentations. The presentations have been pre-recorded so that you will be able to hear the presentation and see the speakers. The presenters themselves will be available live after the pre-recorded presentation so that you have an opportunity to ask questions or to hear the responses to the questions that you've typed in the Q&A. When you type in your question in the Q&A, I would encourage you to identify the speaker at the very beginning of your presentation, of your question, so that we can direct the question to the correct speaker. As I said, there will be a few minutes of Q&A after each presentation, so I encourage you to submit those questions. Our first speaker today is Dr. Torrey Loucks from the University of Alberta in Canada, who will be presenting on a distinct sensitivity auditory feedback in adults who stutter affects fluency, speech fluency, and kinematic variability.
Good morning. It's a great pleasure to be able to present to you today. My name is Torrey Loucks from the University of Alberta. I want to acknowledge my colleagues, Hee-Jong John, Eric Jackson, and Shelley Jo Kraft. Our presentation is Deficit or Difference, and this is a long title. A distinct sensitivity to auditory feedback affects fluency and kinematic variability in adults who stutter. Now, there is a long history of sensory motor research and under that category, audio motor research in stuttering. Some recent evidence is very interesting. Adults who stutter and children who stutter even appear to respond differently to auditory feedback manipulations compared to typically fluent speakers. These differences come in the form of delayed responses to pitch shifts, slower formant shifts during segment production, and less or minimal adaptation to formant shifts. Now, one reasonable conclusion from this is that people who stutter are showing some kind of sensory motor or audio motor deficit. But is there a different way to interpret this? The first caveat to the deficit view is the high variability in audio motor responses, because although in some contexts persons who stutter show differences in how they process auditory feedback manipulations, in other contexts these manipulations induce fluency. Then there is the high variability in typically fluent speakers. As an example, John et al. Found long latency DAF separates typically fluent speakers into high responders and low responders. The high responders have high rates of disfluencies, high rates of speech errors, slower rate of speech, while low responders appear minimally affected. In experiment 1, we asked whether or not persons who stutter are more like high responders or low responders under long latency DAF. The second caveat is speech kinematic variability, which has been found to be higher in both adults who stutter and children who stutter. And it has not been considered whether or not this motor difference encompasses a potential sensory motor deficit. Now, it's clear that language motor interactions and social cognitive manipulations also influence speech variability. So what is the relationship between auditory feedback and kinematic stability? A few studies indicate that long latency DAF can destabilize articulation in adults who do not stutter. In our second experiment, we looked at the effect of auditory feedback manipulations on kinematic variability in stuttering. So 2 experiments to answer these issues. Do adults who stutter have an audio motor deficit or a distinct range of audio motor sensitivity? Our first experiment included 15 young right-handed adults who stutter, who were monolingual native English speakers. Most had a previous history of treatment for stuttering. In the data collection, we asked the individuals to engage in casual conversational speech. We looked at 300 to 500 syllables from samples performed under non-altered feedback, excuse me, and delayed auditory feedback. Our dependent variables were stuttering-like dysfluencies, linguistic dysfluencies, and speech errors. Going on to the results of stuttering-like dysfluencies, under non-altered feedback, we see that there is a range of stuttering dysfluencies that are consistent with the presence of stuttering. Under the delayed auditory feedback condition, almost everyone increased their rate of dysfluencies that would be classified as stuttering. Only one participant decreased their frequency of dysfluencies when engaging in this style of conversational speech. Articulation rate went down considerably in the DAF condition compared to the NAF condition. Here, faster rate under NAF. Now, we went back and compared these results to the original study from John et al., and we found that the adults who stutter resembled the high responders more than the low responders because there was this considerable increase in the rate of dysfluencies, considerable increase in the rate of speech errors, and a large decrease in articulation rate. Okay, in experiment 2, we asked whether kinematic variability would decrease under short latency DAF. In a similar way to which stuttering dysfluencies decrease under short latency DAF. We compared 13 adults who stutter and 15 adults who do not stutter. Again, many of these, all of these folks were younger speakers between the ages of 20 to 30. And also 10 individuals participated in experiment 1 as well. Monolingual speakers. The speech tasks included a simple short utterance of 6 syllables, a simple long utterance of 9 syllables, and a syntactically complex long utterance of 9 syllables as well. They were laden with bilabials. The data collection for speech movements is similar to previous studies. We used motion capture cameras to digitize facial markers at 100 samples per second in 3 dimensions. From these, from this data, we generated a facial mesh to track motions of the upper lip, lower lip, and chin. The auditory manipulations were delivered via insert earphones that were placed during an amplified auditory feedback condition, a 25 millisecond delay condition, and a 50 millisecond delay condition. There was a separate non-altered auditory feedback condition without earphones. We took 2 approaches to doing the variability analysis. The first was to calculate inter-utterance variability of the lower lip using the spatiotemporal index from the group of Smith and others. And basically a higher STI means more variability across utterances and can be interpreted as lower speech motor stability. The second approach followed that of Jackson et al., who looked at intra-utterance variability using recurrence quantification analysis. We use those methods to determine percent determinism, which is the predictability of an underlying system, and max line, which is the stability of an underlying system. Okay, looking first at inter-utterance variability for the simple short utterance, we see that the variability of the adults who stutter is higher overall, similar to previous reports. But at 50 milliseconds, both groups show an increase in variability, but their performance is largely parallel. When we go to the simple long utterance, we see a different result. In this case, the variability of the adults who stutter was higher overall, although there was a decrease in their variability at the 25 millisecond delay that brought them within the range of the typically fluent speakers. A similar but slightly different presentation for the complex long utterances. For the non-delayed feedback, there were group differences with variability of the adults who stutter being higher. At 25 milliseconds, there was a drop in variability for the adults who stutter that approximated that of the fluent controls. And then at 50 milliseconds, their results again look more similar. Going on to intra-utterance variability, the RQA, for percent determinism. Generally, percent determinism was lower for the adults who stutter, meaning their movements were less predictable, but under the delay, the predictability increased and came closer to that of the fluent speakers. In Maxline, there were no group differences, but interestingly, the two delay conditions resulted in a significant increase in the stability of their motions for both groups. Okay, so this is an important result. It shows that DAF alters kinematic variability, particularly short latency DAF alters variability in persons who stutter. Although inter-utterance variability was significantly higher for the stuttering speakers, their variability decreased for the 25 millisecond delay and came close to approximating that of the typically fluent speakers. So short delays benefited their kinematic stability. Looking at intra-utterance variability, it shows that short latency DAF increased the predictability and stability of utterances, and this is consistent with more regular articulatory patterns. Under NAF, the adults who stutter showed less predictable articulation than the typically fluent controls. So, trying to sum up the study and make some big picture predictions or bring up some big picture ideas, the adults who stutter exhibit a distinct continuum of auditory sensitivity that can promote or compromise fluency. Long latency DAF elicited more dysfluencies and slower AR in adults who stutter, consistent with some susceptibility to disruptive feedback. However, short latency DAF facilitated kinematic stability in adults who stutter, both within and across utterances. Now, we all know that there are clinical applications for auditory feedback, but another one could be very subtle feedback manipulations that shift speakers towards a more stable articulation. And it also appears that there is a partial dissociation between the adults who stutter and the adults who do not stutter in their kinematic variability. Generally, the variability of the adults who stutter was decreasing at 25 milliseconds and slightly increasing for the typically fluent speakers. This dissociation and benefit of 25 millisecond DAF parallels the report of Deliri and Max, in which they found different adaptation responses in adults who stutter and typically fluent speakers, depending on what the delay condition was.
Hi, look, I'm not sure if the last part of the presentation got cut off.
Luke, you're on mute. Would you like to unmute your microphone?
Yes, I'm not quite sure either.
I think it might have been just the acknowledgement slide that got cut off.
Hello?
Yes, I can hear you, look.
Okay. Charlotte, can the audience hear us?
Yes, we can hear you. And this is Johnny on technical support. So yes, we can hear you loud and clear.
Okay, so we can start the Q&A questions now.
Yes.
Okay, thank you. Thank you, Dr. Loucks, for this really interesting presentation. My apologies for the last part of the presentation, which apparently got cut off. There was one question that was posed by one of the attendants, asking why is there inconsistency between participants in the delayed auditory feedback and the altered auditory feedback manipulations, which will induce fluency?
So I'm looking at the question. So I'm not sure if you mean the intensity manipulation, but part of it is that the two groups seem to be going in two different directions. Whereas the short latency DAF can lead to more stable articulation in the control speakers, in the speakers who stutter, it may be going the other direction in the fluent participants. At 50 millisecond delay, there's more consistency between the two groups.
Mm-hmm. Thank you. If I may, if I understood it correctly from your data, the participants who stuttered showed an increase in their dysfluencies under delayed auditory feedback condition, which seems to go counter to the general idea that people who stutter are more fluent under delayed auditory feedback conditions. Can you comment on that?
And it was strictly associated with the design of the experiment. And so we did not want the DAF to induce fluency. So we asked them to keep speaking at their regular rate of speech and make it more interactive so that the DAF would be challenging rather than facilitative. If we had asked them to do any kind of rate control strategies, I think the delay would have induced fluency. And again, that is showing this distinct sensitivity that people who stutter have to altered auditory feedback.
So does this mean that, in your view, the effect of delayed auditory feedback is the result of some motor control manipulations that the people who stutter implement, rather than some sort of automatic adjustment that is made at the auditory perception level? Maybe at the neural level?
For the manner in which we did this experiment, I believe these are automatic adjustments that are changing the synchrony between auditory and motor areas. But it's difficult to tell if it's modulating more of the auditory system, modulating more of the motor system. I would say that, however, that you can shift your motor strategy under delayed auditory feedback. And that the shifting in the motor strategy versus automatic compensation isn't very well understood. But a change in speaking state could involve both. It sounds like I'm giving you yes and yes to your answer. And I think it's because it's hard to sort out. Part of what goes on in successful fluency induction could be a change in speaking state and a change in automatic processing of sensory motor interactions.
Okay, thank you. There was one more question which I think is somewhat related. Did you find changes in fluency between the normal auditory feedback and the delayed auditory feedback conditions for either delay?
We really didn't see dysfluencies, as I recall. There were one or two participants who could not be fluent under NAF, and therefore we had to exclude them from the study. So yes, there could be some instances in which fluency is affecting the results, but it wasn't affecting the altered auditory feedback results. In the presentation that I'm giving later on today, I think this factor comes up again because I altered the design considerably in order to allow for dysfluent trials alongside of fluent trials. And I was just very patient in collecting data. And way back when we did this study a few years ago now, we had a set number of trials. And if we didn't get the criterion number of trials that were fluent, we excluded the participant.
Okay, thank you. Maybe one final question. There are no other questions posted, but when I look at your data, you say that, you know, at one particular delayed auditory feedback level, the performance of the people who stuttered approached that of the non-stuttering speakers. But when I look at the data, it seems to be more like a trend rather than a sort of a dip in data. Do you think that's significant?
So it depends on which stimulus we're talking about. I think in the long stimulus, it was more of a trend towards similarity. But then for the complex long stimulus, it was more of a dip.
Okay. Yeah.
But there's a consistency in that it was lower than lower than the variability in the NAF condition.
Thank you. If there are no further questions, then thank you, Dr. Loucks, for your presentation. Really interesting data, and I think we're ready to switch to the next speaker. Thank you so much.
Hi, my name is Dhatri. I'm a postdoc at Department of Communication Sciences and Disorders in University of Pittsburgh. Today I will be presenting my work titled Altered Neural Mechanisms During Audiovisual Integration in Adults Who Stutter. This is work from my PhD thesis, which is funded by Department of Science and Technology, Government of India. Although stuttering is referred to as a developmental disorder of speech, the emerging perspectives point it as a neurodevelopmental disorder involving various mechanisms. Contributions of auditory pathway has been indicated where the evidence shows disruption of the self-monitoring of the acoustic feedback signal, studies showing decrease in stuttering dysfluencies in presence of delayed auditory feedback, studies showing central auditory processing problems in them. Also, lesser prevalence of stuttering is observed in the hearing impaired population. Imaging studies have shown reduced activation in the auditory cortex, specifically superior temporal gyrus, in individuals who stutter during speech production. Also, use of fluency enhancing techniques has been shown to increase the activation in auditory cortex. These studies suggest that in a subgroup of adults who stutter, auditory processing is deficient and auditory cortices may play an important role in etiology of stuttering. However, there are not many studies examining visual perception in individuals with stuttering, and one among few studies suggests visual perception deficits during visuomotor and visuoperceptual tasks. When it comes to neurophysiological basis of audiovisual processing, superior temporal sulcus acts as a locus for audiovisual integration, where it integrates information from auditory cortex, visual cortex, intraparietal areas during audiovisual integration. According to DIVA model, auditory state and auditory error maps, which forms a part of feedback control subsystems, are hypothesized to be represented in the superior temporal cortex area, important in speech production. State feedback control model of speech production, which is generally known as dual stream model, proposes that there is noisy mapping between internal model of vocal tract and sensory system in stuttering, which is mediated by temporoparietal junction, also known as area SPT or auditory motor integration area. The superior temporal cortex area thus appear to be the common area that is activated during both speech production and audiovisual integration. The PET and fMRI studies carried out on individuals who stutter indicate reduced auditory activation in superior temporal gyrus during different speech tasks, which also plays an important role in integration of information from different modalities. This suggests the reduced activations might have an influence on AV integration in adults who stutter, and also due to the fact that the sensory representations are itself faulty or impaired in them. However, there are no studies investigating auditory visual perception in individuals who stutter. Thus, studying auditory visual perception in them will in turn help in understanding the cortical networks and refining the internal models of sensory motor integration during speech production. As the earlier imaging studies have used fMRI, which lacks temporal precision, using electrophysiological approaches or EEG to study AV integration will bring in the temporal aspects of processing in the cortical areas, as stuttering is referred to as a timing disorder. Thus, the aim of the present study was to investigate the behavioral and electrophysiological correlates of audiovisual perception in adults who stutter. For testing this, the participants included two groups. Group 1 consisted of 30 adults who stutter in the age range of 18 to 28 years. The severity of stuttering ranged from mild to severe. Group 2 included 38 gender and language matched adults who do not stutter. The stimuli included audiovisual recordings of 4 syllables, 2 voiced and 2 unvoiced. These audiovisual syllables were edited to obtain 4 different conditions, 4 syllables each in those 4 conditions. Briefly, first condition was audiovisual congruent, where the audio and video were of same syllables. AV audiovisual incongruent syllables had audio and video of recorded syllables mismatched with a voiced and unvoiced syllable, which formed McGurk and non-McGurk variants. Audio-only syllables included still face of the speaker, and video-only syllables had the audio muted. Here are the set of voiced AV syllables used in the study. This is B congruent.
Ba.
The next one is G congruent.
Ga.
The McGurk variant of incongruent syllable had audio counterparts of the syllable with the anterior place of articulation, that is B, dubbed onto the video counterpart of the syllable with posterior place of articulation, that is G. This will lead to perception of a different syllable. So just look at the face of the speaker and listen to the stimulus and see what you hear.
Ba.
The procedure included behavioral and electrophysiological experiment. In the behavioral experiment, participants identified 10 repetitions of each of the syllable in 4 conditions. In electrophysiological experiment, the continuous EEG was recorded from 64 electrodes, which was placed on the scalp as a cap, and the electrical activity from the brain was recorded. Only voice syllable combinations were used for this experiment. The time course of each trial lasted for 4,000 milliseconds. The responses from the behavioral experiment were analyzed to obtain correct identification scores and reaction times for each syllable in 4 different conditions. For the incongruent condition, the correct identification responses were scored as auditory-oriented and McGurk responses. Coming to the results of the behavioral experiment, the identification scores were not significantly different between adults who do not stutter and adults who stutter for all the 4 syllables in congruent and audio-only conditions. Identification scores were at ceiling for most of the participants in both the groups for these conditions. These results suggest that the perception of audiovisual congruent and audio-only syllables are not affected in adults who stutter. The mean identification scores of video-only syllables with more posterior place of articulation were poorer than the syllables with anterior place of articulation, in general for both the groups. Larger confusions in perception of video-only syllables as the place of articulation moves posterior was seen in adults who stutter compared to adults who do not stutter. However, the difference was not statistically significant, which might be due to the large variability in the scores. Large variability of McGurk scores among a group of individuals have been reported widely in the literature, which can be because of the high intensity of auditory stimulus used in the present study, or inherent properties of a particular language and the listener's experience with the specific language. Also, attentional processes might play an important role. The reaction times were not significantly different between the groups for any of the syllables in any of the conditions. Next, moving to the analysis of electrophysiological experiment, the long latency responses or LLRs extracted from the continuous EEG was analyzed for auditory visual interactions, which was obtained from these calculations. This too is a measure of audiovisual integration along with the McGurk syllable perception. Next, the multi-step spatiotemporal analysis, which compares point-to-point-wise amplitude of the waveforms across whole time window, also considering the spatial distribution of the 64 channels, was carried out on the LLR waveforms along with the interaction waveforms. Microstate segmentation analysis was done on audiovisual interaction waveforms and the LLRs obtained for incongruent condition to compare the scalp topographies during audiovisual integration. The spatiotemporal analysis of congruent and audio-only syllables showed significant differences in amplitudes in the time regions that are shaded here in the representation waveform from a single electrode. Higher amplitude was noted in adults who stutter compared to adults who do not stutter during 250 to 400 milliseconds in both congruent and audio-only conditions. And the differences were greater and seen across greater number of electrode sites for audio-only conditions than congruent conditions. You can see that the differences are greater for G syllable than B, both in congruent and audio-only conditions. In audio-only condition, G syllable had differences between groups even at a later time window of 450 to 600 milliseconds. So, according to predictive coding framework, G has lower predictive value when compared to B. Thus, identification of G might be more challenging where the visible cues are not so obvious compared to B, bringing larger differences between the groups. Similar patterns were observed even for the audiovisual interaction waveforms where the differences in activations were more for the G than B syllable, which again can be explained as the low predictive value for G, which is more challenging for adults who stutter. The spatiotemporal analysis of LLR waveforms for incongruent conditions revealed higher amplitudes in adults who stutter than adults who do not stutter during 250 to 350 milliseconds only during perception of McGurk incongruent stimulus, but there were no differences that were seen in the processing of non-McGurk incongruent stimulus at any time window in any electrodes. Thus, we carried out a microstate segmentation analysis, which was done to examine the scalp topographies that are quasi-stationary during the time window of an event. These are the results of microstate segmentation analysis, where the colors of microstates across the time window indicate different scalp topographies. The scalp topography map corresponding to particular color is given below. The approximate brain regions corresponding to these scalp topographies are projected onto the brain that are shown next to the scalp topography maps. This segmentation analysis also revealed differences in topographies between adults who stutter and adults who do not stutter, only for the McGurk incongruent, but not for the non-McGurk incongruent syllable. Activations in isthmus cingulate and paracentral area were absent in adults who stutter. Activation in right posterior superior temporal sulcus in 344 to 370 milliseconds was absent in adults who stutter. So the absence of activation in posterior superior temporal sulcus during McCurk perception in adults who stutter suggests deviant neural pathways during auditory visual integration in them. Deviancies in the neural activation can also be noted at later processing stages in terms of presence of activations in these areas in adults who do not stutter, which was absent in adults who stutter. In these areas. Okay. The microstate segmentation analysis of audiovisual interaction waveforms also revealed neural deviancies in adults who stutter when compared to adults who do not stutter. Activations in the superior frontal and anterior cingulate areas were seen in adults who do not stutter at later processing stages of burst syllable, which was absent in adults who stutter. This anterior cingulate area, along with superior frontal area, is a part of medial prefrontal cortex, and this prefrontal cortex forms a part of brain's default network. And deviations in this brain's default network is linked with deficits found in multisensory integration in individuals with autism. So, collectively, this indicates that the deviant prefrontal connections that are seen in adults who stutter might have an influence on their audiovisual integration. Greater differences were noted during G syllable perception than B, even in terms of brain areas responsible during the interactions. Additional activations in posterior superior temporal sulcus and all these areas were seen in adults who stutter, which was absent in adults who do not stutter. This suggests adults who stutter tend to recruit additional neural resources when the predictive value of a syllable is low, as in G, and this suggests altered neural interactions or pathways during audiovisual interactions or integration in adults who stutter when compared to adults who do not stutter. To conclude, the final behavioral outputs, while identifying the congruent or incongruent audiovisual syllable, are similar in both adults who do not stutter and adults who stutter, but the neural pathways and resources used during the processing of audiovisual stimuli are altered in adults who stutter when compared to adults who do not stutter. This suggests that the neural mechanisms in adults who stutter might be deviant from adults who do not stutter during audiovisual integration, although the final behavioral percept would be similar to their peers. Thank you.
Thank you, Dr. Datri, for this most interesting presentation. Really interesting data that you reported on. So far, we haven't received any questions in the Q&A yet, but we have a couple of minutes. One question I had was with regard to the electrophysiological data that you reported, which seemed where you did find differences between the adults who stutter and the adults who do not stutter, which at least in some of your data seem to locate around 300 milliseconds post-stimulus. Can you comment on that a little bit as to in terms of the potentially underlying processes that this may point to?
Okay, the differences are seen majorly in the later time windows where the earlier peaks where it represents it mainly represents the onset of the syllable, whereas the later peaks and later time regions represent the processing of the syllable, understanding of the syllable. So this suggests that because the differences are at the later time window, this suggests that there might be there might be no problems in whether they are identifying a syllable, but while processing it as either b or g, they find it difficult to process when the visual cues are not so obvious when processing g stimulus when the place of articulation is posterior than when it is when the visual cues are available, wherein as in syllable.
Okay, thank you. Yeah. And then a second question I had, I was intrigued by the connection that you made between the default network, the activation in the frontal cortex areas, the cingulate, etc., and the auditory processing. Can you expand that a little bit as to what you think that relationship is between the default network and the auditory processing?
From the previous studies where they have studied the multisensory integration in individuals with autism, they indicate that this the default brain network is mainly important in audiovisual integration. So while we analyzed the different the scalp topographies that were responsible during audiovisual integration, we found that the differences were mainly seen in these areas in the brain's default network. So the deviations in these brain's default network might be responsible for the audiovisual integration differences that were found between adults who stutter and adults who do not stutter.
Okay, thank you. There's one question about the potential difference between the G and the B, and whether it could be related to the differences between the activation or the needed activation between or inhibition between the vagus nerve and the facial nerve. Can you comment on that one?
Yeah. I'm not sure about the vagus nerve stimulation. I didn't get the question actually.
Yeah. So different parts of the tongue are innervated by different nerves, and I think that's what this question is referring to, whether the differences between G and B could be related to differences in nerve inhibition.
Yeah, it might be responsible, or it may not be. Because
okay. Yeah.
Maybe it's for research.
There's always more questions being raised, so that's great. That's what keeps us going, right? Okay, thank you so much for your most interesting presentation. And I look forward to seeing more of your work. Then it's my pleasure now to introduce our next and third speaker and last speaker of our session today, Dr. Jackson from New York University in the United States, who has provided a pre-recorded presentation on the role of the right dorsolateral prefrontal cortex in stuttering anticipation, and Dr. Jackson will be available for Q&As afterwards.
Hi, everybody. Thanks for joining me today. I'm going to talk about the possible role of right dorsolateral prefrontal cortex, or DLPFC, in stuttering anticipation. First, I just want to acknowledge my collaborators, Swetha Dravida, Adam Noah, and Chen Zhang, and Joy Hirsch from Yale, and Vince Gracco from Haskins, and there's my funding source at the bottom there. So I wanted to start off with a very simple but comprehensive and powerful quote by Wendell Johnson. Stuttering is everything we do trying not to stutter. So this implies that there's some kind of a priori knowledge that if the speaker keeps going, then they are likely to run into trouble or they will stutter. Anticipation has been viewed in many ways, from many perspectives, as a long-term dread or sort of looming anxiety about stuttering. Wendell Johnson described it as a low degree of conscious awareness of impending stuttering, and others look at it as more short-term immediate awareness. So it kind of in the moment or just prior to the moment that an upcoming word or sound will be stuttered. So we're going to go with this last view. So anticipation is the sense that upcoming speech will be stuttered, should that speech be executed as planned. So should the speaker keep going as they originally planned. And it's important to note that anticipation is pervasive in children and adults who stutter, and also that stutterers predict overt stuttering events with extremely high accuracy when given the chance. There are several theoretical accounts or explanations of anticipation. Many of them lean on associative learning. So a person stutters in a certain situation or on a certain word, and then associates the reactions from the environment, from the communicative exchange with that particular word or sound, and then that builds over development. So a sort of learning or a learned phenomenon. And then Rick Arenas introduced that perhaps it's error likelihood monitoring that's at play here, right? So in the phonological loop, for example, in the Levelt model, the speaker becomes aware that something has gone wrong prior to the execution of speech, right? And then as a result of that, they may inhibit, okay? So to be very clear here, I'm not saying that anticipation causes stuttering. I'm also not trying to explain the origin or origins of stuttering events. Rather, I'm interested in how speakers respond to anticipation and how these responses shape the manifestation of overt stuttering events. The knowledge that upcoming speech will be stuttered allows the speaker to respond by altering communication in some way. So that could be avoiding, circumlocuting, stalling, or avoiding altogether, or using some kind of speech strategy, right? But the important thing here is that the process of speech production is changed. Responding to anticipation, or this knowledge that overt stuttering is going to happen, therefore requires cognitive control, which is a broad construct that encompasses planning, initiating, inhibition, as well as being flexible and vigilant to tasks in response to environmental demands. And it's well known that dorsolateral prefrontal cortex, DLPFC, supports cognitive control. So I thought it would be helpful to use this simplified model of the stuttering event. So the speaker has an intention to say a word, but then there's a glitch, right? So probably at a neural level, prior to overt execution, there's some sort of glitch. That's the beginning of the stuttering event. Then the speaker becomes aware that there was a glitch, again, prior to the overt stuttering event. At this point, the person will react or respond to that awareness, right? So that could be on an emotional level with fear or anxiety, or that could be on a behavioral level. For example, again, avoiding, using a speaking strategy, and then the speaker will produce the word, right? So it's important to note here that there will be cases when stuttered words are not anticipated, right? That could happen when, for example, the rate of speech is fast, or just that the speaker is not attending that closely to the speech production system. Although I do want to point out, again, though, that when given the chance, speakers anticipate stuttering, predict overt stuttering with extremely high accuracy. Therefore, if a situation is created in which stutterers produce a near equal amount of stuttered and fluent speech, and stutterers are presented with a word and asked to produce that word after a waiting period, then we can measure neural activation prior to speech onset to determine neural substrates of anticipation. So that's the logic here. The first hypothesis is that stutterers will exhibit elevated activation in DLPFC prior to stuttered versus fluent speech, which we believe are reflective of cognitive control processes associated with anticipation. And the second hypothesis is that stuttered responses will be associated with longer response times, reflecting cognitive control processes. So we recruited 33 adult stutterers, 22 were included after the NEARS screening. Not all speakers are good candidates for NEARS, important to note. There were 2 visits. The first visit included the NEARS screening, the stuttering diagnosis, and also the clinical interview to determine anticipated and unanticipated words. So I've described this approach in a 2019 paper, but the idea here is that we were generating these 2 lists of words so that we could create the stimuli so that the speakers would produce these and we would get a near equal amount of stuttered and non-stuttered speech during testing. And the second visit, of course, was the NEARS experiment. So the tasks involved participants responding to questions. The answers to these questions were those anticipated and unanticipated words. The anticipated and unanticipated words were matched in syllable length. The participants reviewed the questions prior to the experiment to minimize the potential impact of language retrieval or formulation processes. There I am on the left there, sitting in the NEARS room, just to give you a sense of what the experiment looked like. The question lasted between 1 and 3 seconds approximately. Then there was a 5-second waiting period, right? This is where we assumed that anticipation would happen prior to the stuttered speech. Then there was the execution period, which lasted 3 seconds. We asked participants first if they were okay to stop, if they were still stuttering after 3 seconds. And then all of the participants were okay with that. And then there was a 12-second rest period so that the hemodynamic activity could return back to baseline. There were 80 trials in total in 8 runs, so 10 trials per run with 5 anticipated and 5 unanticipated words per run. We used a lab NEARS system with 40 emitters and 40 detectors that were arranged in a full head format in a 134 channel layout, though importantly here we only focus on DLPFC. The absorption of light measures were converted to concentration changes for deoxygenated, oxygenated, and total hemoglobin using the modified Beer-Lambert equation, which is standard practice in NEARS. And the anatomical locations of the optodes were determined with a Patriot 3D digitizer from Polymus and using linear transform techniques. So in terms of the speech analysis, we used the 3-point scale which is described in my 2019 paper. 0 was unambiguous fluency. We were sure that the word was not stuttered. 1 was ambiguous. Perhaps there was a slight pause, hesitation, or even a subtle accessory behavior. And 2 was unambiguous stuttering. Response time was calculated as the time between the go and speech onset, as defined by the first sign of speech, whether articulatory or acoustic. And we believe that this is more conservative than previous approaches, such as phonation onset, for example, which may be delayed due to stuttering. The event epochs, or the block regressors, were 7 seconds long. So they started during the anticipation, the waiting period, and then they went 2 seconds into the production period. They were convolved with a standard hemodynamic response function, which was fitted to the data. Importantly, the block regressors were modulated in height in the first level analysis by speech response, right? So 2, stuttered, was greater or lesser than 1, ambiguous, which was greater or lesser than 0, fluent. Beta value coordinates were converted to standard M&I space using NEARS SPM. For the region of interest analysis, for the ROI analysis, we created 10mm spheres using those coordinates up on screen here. Significance was tested at p.05 by determining the overlap between the masks for this region and activation from the second level analysis using one-tailed t-tests in SPM8. And here is what we expected the hemodynamic response to look like, right? So with a peak, potentially, perhaps I should say, just prior to the overt execution of speech, or maybe at the start of it. So we found, and these results have been reported in my 2019 paper, a near equal distribution of stuttered and fluent speech, with approximately 13% of these words being ambiguous. I don't want to go through this whole table, but it's important to point out here that of the anticipated words, only 54% of them were stuttered, and of the unanticipated words, only 51% of those were fluent. Stuttered responses were associated with greater response times than fluent responses. Indeed, within the mask that we used for DLPFC, stuttered speech were preceded with greater activation than fluent speech. And I just wanted to show you the whole brain results here, only to point out that the cluster that included right dorsolateral prefrontal cortex here, actually the peak of that cluster was frontal eye fields. And the cluster also included premotor or supplementary motor cortex here. So important to point that out. So stuttering words were associated with elevated activation in right DLPFC during the waiting phase, which we assert indicates anticipation or neuroresponses underlying anticipation. And stuttered words had longer response times than fluent words, right? So the stutterers took longer to initiate the stutter than the fluent words. So responding to stuttering, anticipation appears to be associated with increased activation in DLPFC due to increased cognitive control. But of course, DLPFC is part of a larger network that mediates the cognitive control related to responding to anticipation. For example, it's part of a network including the caudate and thalamus that regulates proactive inhibition, which Neef and colleagues in a 2018 paper speculated is involved in responding to anticipation. And more broadly, DLPFC is part of a large-scale network, including SMG, SMA, IFG, subthalamic nucleus, putamen, that are involved in response inhibition, right? And if you look at the whole brain results, all of these areas exhibited greater activation prior to stutter than fluent speech, except for left premotor cortex, which is a finding in line with the literature. So to wrap up, DLPFC appears to play a role in stuttering anticipation, likely underlying the cognitive control necessary to respond to anticipation, but more work is needed to specify this role, particularly in the context of large-scale networks. And this work extends the study of stuttering from the sensory motor into the cognitive domain, particularly regarding how cognitive control shapes the manifestation of overt stuttering events. Thank you very much for listening.
Thank you, Dr. Jackson, for this really intriguing presentation. Some good data here.
Myself on video there.
Yeah. So we have a few questions. We have a few minutes left. We have a few questions. One of the questions had to do with essentially referring to what instructions the participants were given to do essentially during that moment of anticipation. Whether they were told not to avoid the stuttering moment.
So this is an interesting question, and I'm actually kind of intrigued by what the motivation of this question is. So during the waiting phase, the participants were just instructed to wait, and that they would be getting a go signal at some point, and then when they got the go signal to produce the word, and that was it.
Okay. I had a related question to this. Is it possible, you said, that what you're measuring during that time period is the anticipatory behavior. Is there also a possibility that people, especially when they're anticipating stuttering, might have some sort of articulatory rehearsal behavior that could happen during that silent pre-response interval, which may be somewhat different from the pure cognitive anticipation component?
Yeah, it certainly is possible. The assumption that is being made here is that might, or I guess likely wouldn't be happening in DLPFC. At least I'm not aware that that's going to happen in DLPFC. So the assumption here is that because of the role and function of DLPFC, that it's probably related to cognitive control. Although if there's some literature that I'm missing, I would be happy to learn about it.
Okay. One of the questions I had to it's more of a technical question. Why some people were excluded from the Afner's experiment?
Yeah, so there are a whole bunch of factors that can potentially make some participants not good candidates, meaning that the light's just not going to get through. So this could be skull density, skull size, tissue, hair, so a whole bunch of different factors. And what we did was we just used a basic finger thumb tapping task. And if we saw a reliable response somewhere in motor cortex to this task, then the participants were included. This potentially is not the best way to go about this. If anybody has thoughts on this, I would love to talk to them about it. I'm somewhat concerned that we potentially lost some participants who actually may have been good, or who actually could have provided some reliable data. But at the time, this was the best way that we knew how to go about this.
Mm-hmm. Okay. In some of the data that we've collected and reported, we have found that there's actually quite a good correlation, at least in a number of people, quite good correlation between anticipation that happens up to two weeks or even longer before the actual speech recording, which seems to indicate that the glitch that you're talking about may at least in some cases, be more cognitive than sensory motor. Can you comment on that?
I'll try to, Luke. So the fact that anticipation might be there a week, 2 weeks, even longer, I think is well, it's obviously likely. Like we obviously know that that's the case, and then this data and these data that you're talking about seem to support that. It's a difficult question to answer. I think my first thought is that perhaps it may be more cognitively weighted, but I would not be surprised if the speech motor control system was involved at that point as well. So if you think about it, if a person's going to put themselves in a particular speaking situation, then and thinking about producing a word in that situation, then how could the speech motor control system not be involved in some way? So that's the best way I can answer it. I don't know that that's the case. I don't know that that happens, and I think it's a really important question to target.
Thank you. Thank you so much for this really interesting data. There were a number of other questions, among others related to Sheehan's approach avoidance model of stuttering. We ran out of time, but I would certainly encourage people to, if it's okay with you, to contact you directly and maybe address it if they're interested in that. But thank you so much, and thanks to all of our speakers at our session today for their presentations and their Q&A participation. This concludes the session today. Thank you all for participating.